Okay, so today I'll be inserting a Foley catheter into my patient, and I'm going to be explaining both male and female. Before I go in, I want to make sure that I know the order for this patient, and I want to make sure for what reason it is that they are getting a Foley catheter. Once I have all my information, I'm going to go in and see my patient. So, hi, my name's Natalie. I'm a student nurse, and today I'll be performing a Foley catheter, so I'm going to be inserting it, okay? Do you have any questions? No? Alright, great. So before we begin, I'm going to actually grab some hand hygiene. And can I get your first and last name and your date of birth, please? Great, thank you. And then can I, do you have any allergies? No? Do you have any allergies towards iodine or latex? No? Okay, great. So I'm going to actually go get started. So I'm going to have my patient laying flat, and I'm going to have them at a working level, so about waist level, raising the bed. And then I'm also going to make sure that I have their knees flexed and that they're in a butterfly position. So once my patient is comfortable and positioned, I'm going to go ahead and I'm going to hand hygiene again and don on some clean gloves to clean the genital area. So for a female, I'm going to have my wipes ready, preferably warmed so that it's more comfortable for my patient. So I'm going to grab a wipe here, and I'm going to go ahead and go from top to bottom, so from least contaminated to most contaminated area, one labia at a time, and using a downward motion. Okay, and then the last one from top to bottom. Okay, great. And if it were a male, I would go ahead and start at the tip and then work down using downward motions, just one wipe at a time, going from the tip to the shaft. If they were uncircumcised, then I would have to pull the foreskin backward and clean the area, and then from top to bottom again, and then reposition the foreskin. Once I have that done, I'm going to go ahead and remove this clean gloves. And I'm going to perform hand hygiene one more time. So I'm going to go ahead and start getting my sterile field ready. So I'm going to go ahead and bring my box forward, and I'm going to open the first flap away from my body, and then I'm going to go ahead and open these two flaps one at a time, and then this last one towards me, making sure not to touch the inside. So I'm going to go ahead and, without reaching over the sterile field, turn my drape around. We have a 1-inch margin of worth of workspace, so that would be okay. Alright, so then I'm going to go ahead and don on my sterile gloves before I touch anything else. In a bigger setting, I wouldn't have to touch this here, but I want to show me donning on my sterile gloves. So I would open this up here. And then I would go ahead and don the first glove, grabbing the cuff, and that's good. I'm going to now use the scoop method, scooping up the other glove, and then inserting the thumb without touching the skin. Okay, so now my gloves are on, and I can go ahead and retract this backward, but I'm going to keep it like that. I'm going to go ahead and pinch the inside of it and get rid of it. Now I can touch the inside here. So I'm going to position my box like so. I'm going to go ahead and open it. And I'm going to use this first drape here to put under my patient. And just keeping an eye on them and just asking them how they're doing. I want to make sure that when I apply this drape, I'm not breaking sterility, so I'm not touching my patient or anything else. So once that drape is on, I'm going to go ahead and add a fenestrated drape. And this is according to hospital policy. Some hospitals don't require it, but it's just so that we prevent less microbes from getting into the area. So I'm going to go ahead and place that over my patient like so. And then I'm going to go ahead and grab my contents out of my box. So I have my sterile water, I have my iodine here, I have some soap towelettes, and then I have my, where I'm going to collect my specimen sample from. Some gel there, and then I have my lubricant as well. So I'm going to go ahead and grab the tip of the catheter here. And just going to unwind it a little bit. So I'm going to go ahead and remove this plastic here. Careful. Okay, throwing that away without touching anything else. I'm going to grab some of my sterile or my lubricant here and pour some into this tray. Okay, and then I'm going to have my tube here sitting in there. I'm going to go ahead and attach my water to my tubing here. Okay, so now that I have that set up, I'm going to go ahead and apply the iodine to my patient. So I'm going to go ahead and open my packaging, and now I'm going to use this one hand. It's going to become non-sterile. So I'm going to go ahead and open the labias, spread them apart, and using one iodine, I'm going to go from top to bottom, throwing it away, grabbing another one, top from bottom, and throwing it away, and then one more from top to bottom in the center and throwing it away. If it were a male, again, we would start at the top and work our way down to the shaft, working in circular motion at the tip, and then going downwards until we finish only using one swipe at a time. So then after that is done, I'm going to go ahead and insert the catheter. So it is lubricated about 2 inches in. So I'm going to go ahead and tell my patient to take deep breaths. So okay, you're going to feel a little bit of pressure, okay? So we're going to get started and pushing in. Deep breaths, deep breaths, deep breaths, deep breaths, deep breaths, deep breaths, deep breaths. Good job. And it is in. Once I see some urine output, I'm going to go ahead and know that I'm in the correct position. So I'm going to go ahead and just go in a little bit further just to make sure I'm not at the neck of the bladder. And I'm going to go ahead and insert my sterile water to inflate the balloon. And once I have that in, I'm going to tug a little bit just to make sure that that water is inflated. So if I feel some resistance, I know that my balloon's inflated. So now my patient is good in the insertion. So then I would go ahead and grab my catheter, the Foley bag here, and put it on the side of the bed, and making sure that it is not it's not like hanging and touching the ground. So once I have this out and hanging on the bed, I can go ahead and collect my sample from directly the bag if it's like a brand new thing, or if it's been sitting there for a while, I can't grab my sample from there, and then I would have to go and grab from the tubing. So I just want to tell my patient you did a really good job, and let me know if you feel uncomfortable or something's, if you're in pain. So once I grab my sample, I would go ahead and take it to the lab, and it's so that we know that if the patient had a UTI or an infection before the catheter, we know that it wasn't due to the catheter insertion. So once I have all that done, I'm going to go ahead and clean up and have my patient in the lowest position, and have their collet with them, have them covered, and making them comfortable. And that is all for the catheter insertion.